Everyone, I think we're ready to get started. So thanks everyone for joining us. I'm going to start off with public comment. So are there any members of the public who would like to share any words of wisdom with us at our meeting today? Yes, ma'am. Thanks for being here.
Good afternoon.
Hey.
I'm Cassidy Moore. I work with Asheville Habitat for Humanity. I wish to express my support for policies that prevent source of income discrimination and increase rental assistance acceptance in government-funded or incentivized projects. As you know, in Buncombe County, 1 out of every 3 issued housing vouchers go unused each year. Source of income discrimination plays a large role in compounding Buncombe County's affordable housing crisis, leaving many families perpetually stuck in substandard or temporary housing, or even worse, homeless. I'm grateful for the important work of community partners such as Thrive and BRAC to help address the critically high rate of unused housing vouchers. These federal resources should be fully utilized to address our local affordable housing crisis. Improved policies will help get us closer to the goal of ensuring every single available housing voucher is put to use in our community. Thanks.
Thank you. All right, anyone else? Okay, great. So I believe we need to approve the minutes from the September 5th meeting. Motion. Right, all in favor, say aye. Aye. Any opposed? Great. Okay, first item under new business, Affordable Housing Services Program revisions.
Good afternoon. I will be sort of walking us through some of the changes that we are looking to make to the Affordable Housing Services Program this year as we roll into the next funding cycle. Basically, as staff have been managing the program over the last year and interacting with some of our community partners and potential applicants, reaching out to community partners last month as part of the community feedback session, been able to gather some information and make some improvements, make some tweaks for the program. So we wanted to talk through that, give you all an idea of where staff, where we were thinking of making adjustments, and also give you all some time to discuss and share your thoughts with us. And then later this month on the 17th, we'll have a follow-up meeting and we can bring any of those ideas and thoughts back and do any additional research there. So the first item is part of a collection of small adjustments that we're looking to make in income, rent, and sales price in the language in the policy. So side by side, our current policy basically references the current income tables that would apply for households that we would be able to assist. So our program would still be limited to serving households at 80% of area median income. But as a bit of a clarification, the new language that we're proposing would be to make that requirement effective at the time of sale for unit that's being sold for home ownership. And that's really just to reflect the fact that we are basing our limits on HUD's published limits that come out annually. So when we send out an RFP or the application, when folks are applying for the program, that information is helpful for them to demonstrate how their program will operate and who they will serve. But then within the coming months, we see that HUD updates those numbers. And so in our contracts, in our applications, we just want to make sure it's clear that that time frame lines up with when a household is receiving assistance. So same language reflected here for the sales price limit. Again, HUD annually updates the value of a home, the sales price of a home that would be affordable. So they're looking at the median sales price, and we're limited to 95% of whatever that number is annually. And so rather than having a static number or having some potential confusion about what number we're going by as programs progress throughout the year, we would set that to be at the time of the individual home sale. We would follow the same language for rental units. And in this case, rather than a home sale, obviously we would be talking about the lease. When a household signs their lease, we would want to make sure that they were eligible at that point in time. Almost done with the annual updates from HUD, but again, we're following the timing of the lease to reflect rents. So again, HUD releases their annual rent limits, and we follow those guidelines. And so the same rent limits would apply at the time of lease, rather than looking back at our application cycle. In the same theme of income eligibility, we've also reviewed sort of the process in place for a number of our partners in re-examining or examining a household income. So when a household reaches out to one of our funded programs and makes application, that partner is doing their due diligence and reviewing income, pay stubs, Social Security, documentation for any kind of income assistance that that household might be receiving. There's not currently a time frame in our guidelines. So what staff are recommending would be that there is a 6-month time frame placed on that verification. So when a household applies, that determination of eligibility within the 80% AMI or under the 80% AMI would be good for 6 months. We don't want to create an undue burden on our partners to continue to reevaluate households as they're working with them, but want to find some sort of responsible time frame so that we can make sure that we are staying within our own guidelines on assisting households that are eligible. Also recognizing that there are some programs that have wait lists, and as a wait list might grow, there may be a delay between when a household initially requests assistance and when that determination is made. So as part of sort of the administrative process, we would want to encourage partners to review those verifications in 6-month increments.
And have you gotten feedback from like developers or operators of developments on that policy?
We haven't had any specific feedback on this one.
And have we run these by folks? I mean, this is
Not this one specifically.
Yeah. Okay. I mean, it sounds great. It would be interesting to hear if there's any like feedback on it.
Okay, we can do that. So moving along, this one is a little more substantial in change as it relates to funding amounts. So as we review applications, we currently have for any construction projects a 10% limit per affordable unit of the cost of constructing that unit. Specifically for 4% low-income housing tax credit project, that limit has been increased, has stayed at 20%. And it's not listed on this slide, but for projects that are specifically serving households under 30% of area median income, there is an allowance to request funding at higher percentages. So that's a little more negotiable. It's really no surprise that we're seeing increased costs straight across the board, specifically with construction. And we also know that construction costs locally are higher than they are in other areas. So one way to accommodate some of that would be to increase our funding thresholds for the percentage of construction. Looking at some of the past projects, we know that they have come in under the previous thresholds on average. We've also had a couple of projects that are still trying to close those gaps. This would allow for some flexibility in that decision-making process. It wouldn't require that projects request that, although we would expect a number of projects would include the maximum amount, but we could certainly continue with our staff analysis as we have before and identify what the stated gap is, and this would allow a little more flexibility in the decision-making process.
Let me ask this, in the context of like the overall application process, let's just say we approve these adjustments. Is there language in the RFPs or in the overall program that sort of emphasizes like, these are the maximum, loan amounts that the policy contemplates? But we also contemplate that folks will not seek the maximum amount unless the project, it is required for the project to be viable. So kind of talk that through, because you say like some applicants don't seek the full amount, others do. Some have requested or pointed out a need for greater than that. So just how is that kind of couched in the application process so folks understand like we're trying to stretch these limited dollars to do as many projects as possible. So here's the policies, but don't just default to the maximum amount. It should be project specific.
So part of that is listed in our preferences in the policy. So for instance, projects that identify other sources that can support closing the gap that they're demonstrating. And so part of our analysis is, as staff, is to review their performance and evaluate what funding is available compared to what their stated gaps are. And projects that can demonstrate a smaller percentage would be obviously preferable because it would make our funding go further. So the next item that also does not have a current place in our policy, defined the same way, would be the acceptance of rental subsidies. As we have worked with partners, funded agencies, as well as community partners that are working in the space providing rental assistance, there is consistent feedback about the struggle for families and households with rental assistance securing rental units that accept those funding sources as rent. Our current policy does provide a strong preference for developments that do accept vouchers, but the intent of this would be to prevent that from being a disqualifying factor for property managers and developers. Again, as was shared during the public comment, we recognize that there are a number of rental assistance sources out there. We haven't received any feedback about previously funded affordable housing service projects that are limiting households, but this would be a measure for us to communicate as a county that we want to see those rental subsidies used effectively, and that projects funded with the Affordable Housing Service Program would be required to use those sources.
Sure.
Next, we have tax exemption. The current policy prohibits projects that are seeking funding from obtaining a property tax exemption. The tax assessor joined one of the previous meetings earlier this year to share more information about that and the mechanisms by which that's allowed. We have received feedback from developers indicating that a change like this, allowing a tax exemption, would potentially increase the capacity for projects to support debt from other sources, otherwise funding their project outside of the Affordable Housing Service Program, basically reducing their operating expenses and freeing up some of that operating income to support higher debt amounts in their permanent lending or from other sources. So in theory, it would reduce the gap that the request is coming to the county for.
So this is saying you can do that. You can do that now.
Yes,
Everybody can do that.
yes.
Okay.
The limitation here would be, it says where applicant is eligible to seek a property tax exemption, that would still be based on either a nonprofit developer making that request, or that the limited partnership would include the nonprofit partner in the project that would be eligible to request that exemption.
So, I guess one question I have is like, I mean, I'm open to this idea, but this is a pretty meaningful decision, right? In terms of like how it affects the performance on projects. I mean, this would affect performance in a good way, right?
Correct.
I mean, in a lot of places around the state where there's no bond funding or other local government funding, like basically this is the policy that enables a lot of projects to happen, right? So like, and you get your tax credits, you maybe get a state loan or something, but you don't pay any property taxes. So it's pretty, that's it. There's not, some housing trust fund in most counties in North Carolina, right? So, so I guess partly the question would be like, if we went to this route, I kind of wonder if it makes sense to do this concurrently with also raising the per unit subsidies like we were talking about on the other one, because I mean, I think either of them kind of makes sense, but if we do them together, I kind of wonder, are we, even though I know we will scrutinize all these applications and, there'll be a negotiation process, I wonder if it's doing them both simultaneously is, because they're both pretty meaningful steps in terms of us signaling, like we are preparing to start investing a lot more Buncombe County subsidy in every single unit that gets brought forward, and you are welcome and invited to ask for that amount. And again, even though I know we try to negotiate this, like that's, we want to try to find that sweet spot of like projects work, right? But we stretch these dollars to get as many projects funded and as many units funded as possible. So I guess that's the question that comes to mind for me, is like kind of open to either of these, but should we do them both at the same time, or sort of try one, see how that works for a while, and then if we're just consistently seeing like projects need both, they're just, or otherwise we're just going to be constantly considering deviations from the policy to provide extra funding where it's, it's justified. I don't know. That's the question I have around it.
Okay. With our the way we've got this process scheduled, as far as coming back, we could keep this in consideration and bring it back to you on the 17th and troubleshoot and maybe test out what this would look like for our current slate of projects, how that would have compared if these policies were in place at the time, and bring that for consideration to your next meeting.
Okay. I would appreciate that. I mean, I'm open to the idea. It's like, hey, we have enough data now to say yes to this, but I'd love to see just a bit more analysis around that kind of stuff.
Okay.
Yeah, cool.
I'm looking, it's just a sample.
Okay.
Of projects, but yeah.
Get everyone. Yep. One of the things I was talking to some of our friends who put a proposal forward, and one of the things they mentioned was that if a project is located inside a municipal boundary, that our policy effectively means that they're also not able to pursue, or that basically we have to grant, they either have to pay both or pay neither of the property taxes, right? There's not, hey, just if the county's funding your project, we would prefer you to pay your county property taxes, but it's kind of all or nothing on the local taxes. So, all right. What else?
So on a similar vein with increasing the maximum loan amount for construction projects, we would consider mirroring that with the down payment assistance. Again, recognizing increases across the board in home costs and doing a similar 5% increase that would be available again at the consideration of the board. And then finally, for the timeline of our RFP process or our application, we would maintain a pretty consistent schedule, looking to open that opportunity in mid-December, host an application conference with potential applicants, and have a chance for staff to troubleshoot questions and share the framework of the policy. In January, we have listed the LIHTC application deadline in this schedule, just to reflect when we know that a number of developers will be very focused on an important step in their project. And then shifting the due date for the Affordable Housing Service Program application from early February and backing that up a couple of weeks to the end of January, allowing a little more time for the staff analysis to take place, to connect with applicants and clarify any questions. We have had a preliminary meeting with county or with city staff to confirm that their timelines would align with this. We're still working out exactly what those dates would be, but would be working on a similar timetable so that those decisions for projects that are applying to both sources would be happening at the same time. And as with previous years, that would put us into a series of meetings in the spring to bring that staff analysis to you all for consideration. So really the biggest change here would be just reducing the amount of time that the application is open by a couple of weeks. And so those are the revisions to the process that we have at this time, and we can certainly bring any or all of these back to you as you would be interested in hearing more, but I would also welcome any other input, any suggestions that you would consider. We'll bring this back to you for
Great. Great. All right. Any other questions or feedback on it for now? Okay. I think it all sounds positive. We just had some questions on, those, a couple of those that we spoke to earlier. So sounds good.
Thank you
So
very
we'll
much.
take next steps and we'll revisit it. This will come back to the next meeting for
Yes.
a final decision. Terrific. All right. Are we ready to move on to the continuum of care?
Yes. Good afternoon. So I'm going to share some information with you all today about the funding cycles for our continuum of care, the process that we follow, what the funds are used for, and who has applied for funds this year. So first, a little bit about who's kind of at the table when it comes to decision making around funding cycles. So we have the Homeless Initiative Advisory Committee. That, of course, is the governing board for our COC, and they are responsible for the final approval for recommendations for funding for our continuum of care. The City of Asheville is the lead agency for the COC, and for this process, they are also the COC collaborative applicant. So that means that they facilitate access to the different funding streams that we have available. They manage the process from receipt of project applications to the final submission of the applications once decisions are made. And then we have the HIAC funding allocations work group. So that's a work group that reviews and scores the project applications, and they make recommendations to HIAC. That group is made up of HIAC members and a couple of community members as well. In our COC, we have 2 grant funding cycles. The first is the Emergency Solutions Grant, or ESG. So those are HUD funds that are administered via North Carolina Department of Health and Human Services. And then we also have HUD Continuum of Care grants, or HUD COC funds. And those are administered directly by HUD. I'm going to share a little bit more about each of those funding sources in just a moment. So as the collaborative applicant for our Continuum of Care, the city facilitates the access to those streams. As I mentioned before, staff on the city's homeless strategy team manage the application process. So once they receive applications, the HIAC funding allocations work group reviews the responses, they rank the projects if that's necessary, and then they make recommendations to HIAC. HIAC reviews those recommendations and then approves or changes as needed the applications. And then the collaborative applicant submits HIAC approved applications to HUD and North Carolina DHHS to make the final awards. And the awards are made directly from HUD and DHHS to the project applicants. So a little bit about ESG. ESG funds are intended to be used as a crisis response using low barrier and housing first approaches. The eligible activities for this funding fall into 2 categories. So we have emergency response activities, that's street outreach and emergency shelter. And programs applying for funding for those activities must utilize low barrier and housing first approaches. And then we have housing stability activities, which is rapid rehousing and homelessness prevention. And those programs need to use housing first approaches as well. This year, the allocation for funding for ESG for our COC was $127,904. The applications were submitted to North Carolina DHHS on August 21st. And we anticipate award notification in winter of this year and for contracts to begin on January 1st of 2024. And so here are the projects that comprised our application for this year for ESG. All of these projects have received ESG funding before. The funding allocations work group had to be pretty strategic in their decision making because, as you can see, the request amount was quite a bit larger than the allocated amount. Ultimately, the work group decided to focus on rapid rehousing in keeping with the National Alliance to End Homelessness recommendation that we add rapid rehousing slots to our community's housing interventions. And then they also decided to focus on homelessness prevention, in large part because providers in the community let them know that there's been a tremendous need for that service in our community this year. And the funding that has been available is already not quite enough to meet that need. They decided not to fund street outreach, mostly because ESG has a bit of a heavy lift administratively, and relative to the amount requested here, they just felt like it wasn't really going to be a good choice. And then they decreased the amount of the request for emergency shelter for Salvation Army. That was a tough choice for them, I think, but they did that in order to prioritize housing stability services. Any questions so far?
So is the Salvation Army emergency shelter work, so the county's looking at paying for a bunch of that, right? So are we stepping into that part, or is that different subset of their work, or just?
I
So
think
it's not getting funded through this particular grant. Is there any other context for what is happening from that point?
So the Salvation Army was relying on ESG COVID funds. And since those COVID funds have come to an end, that's why their request was so substantial for ESG annual funds this year. But because of the limited amount available in ESG funding for our community, I think the funding work group really just had to make a tough decision. And so the shelter expansion, I think temporarily will be stepping in to help with some of that funding.
We are stepping in, and the city
Yes.
stepping in.
Yes. Yeah. And so moving on to the HUD COC grants. So Continuum of Care funds just generally support homelessness and housing programs throughout the country. In our community, these funds support many of our permanent supportive housing programs. The estimated funding available for our COC this year was $2,166,409. And our consolidated application was submitted September 28th, so just last week. And we are anticipating award notification in spring of next year, and the contracts will begin January 1st of 2025. And so here are the projects for our HUD COC funding for this year. And almost all of these are renewal projects with the exception of the 2 rapid rehousing bonus projects from Helpmate and Homeward Bound. Everything else is a renewal project. So these projects were ranked by the funding allocations work group using a scorecard that is based on HUD requirements. Points are awarded to programs based on their performance in previous years and appropriate expenditure of funds, as well as their alignment with HUD COC funding objectives. As I mentioned before, HUD COC funds are supporting many of our community's permanent supportive housing projects, and you can see that represented here. They're supporting quite a few projects at Homeward Bound. And these funds also provide some support for HMIS administration, and we're also applying for a COC planning grant this year. Any questions about HUD COC funds or about the process in general? Okay.
Sorry, I have one.
Sure.
How does this, from this person I've seen this before, how does this year's level of funding compare to past years, perhaps pre-COVID years? Would be
That is a great question. I think that this year's level of funding is a little less than last year. I can certainly do some research on what it was like pre-COVID and report that back to you.
I assume the program existed in a similar way back then. But
Yes.
then there was kind of a new layer of funding with COVID. And now we're kind of back to,
Well, HUD
Well, more of
COC funding has kind of been the same.
okay.
I'm not aware of specific COVID funding for these funds, only for ESG.
As these decisions are being made, are they compared to what the recommendations are in the National
Yes.
Homelessness Report, as you previously mentioned, with rapid rehousing? So that is a lens that these. are
Yes. Yeah, the work group is definitely taking that into consideration.
So obviously, we're not like reviewing all these proposals. It's not our job to do that. But just out of curiosity, like, what's the difference? Like, 4 of the 10 projects are called permanent supported housing. They're all from Homeward Bound, right? And it's like permanent supported housing 1, 2, which is listed twice, and then 5. So just could you just kind of tell us a little bit about like what are these things that all sound like one another, but obviously there's some distinction between at least 2 of them, or 2 out of 3.
So actually, I can weigh in on that,
Okay.
having been part of the homeless initiative at the city for a while. Some of those are projects that were once bonus projects or expansions of projects. And so HUD would allocate a certain amount or tell the community how much they were eligible for. And those projects would apply. And then the next year, there would be an additional amount available and they could add a new program. And so it would increase the available funding each year. And HUD would then the following year approve a renewal for the first project as well as any of the expanded projects. And then they would have another opportunity to expand. And so the potential for increasing the amount of funding exists, and the numbering system represents some of those projects that happen over time.
That's really helpful.
Okay. All right. Thanks for all the updates on that.
Yeah.
And now on to point in time.
Yep, absolutely. So now I'm going to just give you guys some information about this year's point in time count in our community. So the point in time count, it's also known as the PIT count. It's an unduplicated count on a single night of the people in a community who are experiencing literal homelessness. And so HUD requires that each community that receives funding to address homelessness conduct a PIC count sometime within the last 10 days of January each year. The PIC count specifically counts people that are experiencing unsheltered homelessness, as well as folks who are staying in shelter or in transitional housing projects. Our PIC count was conducted on January 31st this year, and we had the largest number of volunteers ever participating in the effort, including some staff from our community development department. Shelters and transitional housing provided data on people in their programs that night, and 75 volunteers conducted a street count. AHOPE and Haywood Street congregation surveyed unsheltered people the following day as well for the PIC count. And so here is a snapshot of our point in time count results for the last couple of years. You can see that our baseline pre-pandemic in 2020 was 482 sheltered individuals and 65 unsheltered. In 2021, we saw a huge increase in unsheltered homeless folks, and that is likely due, at least in part, to shelters being forced to operate on limited capacity during that time. There was another big jump in 2022. And then as we saw shelter beds start to come back online in the recovery from the pandemic, the number of unsheltered decreased a little bit for this year's PIC count, but is still, as you can see, quite a bit higher than it was pre-pandemic. And then we have another look at the data grouped by race. And I just want to point out here that what's a little bit concerning is the disproportionate ratio of Black or African-American homeless individuals in our community as compared to the population within the county. So Black residents represent only around 6% of Buncombe County's population, but you can see here they represent 19.7% of the PIC count. And when you take a look back at our COC's data, back from 2020 until now, that's a pretty consistent percentage. There are some really small decreases in the number of Black or African-American individuals experiencing homelessness, but the percentage as part of the PIC count stays between 19 and 25% each year, and that's consistent from 2020 until now. And then I have another look at the data grouped by gender. And so the number here is pretty consistent for males and females from 2020 until now, although all groups did experience a significant increase in 2022. One thing that I thought was interesting is that although the number of transgender individuals experiencing homelessness in our community, according to this count, is low, it has doubled each year since 2021.
Meaning lower than last year.
Meaning higher. It was 1 in 2021, and then 2 in 2022, and now 4.
Oh, I see.
Yeah. And then finally, another look at the numbers just by ethnicity. So like the other data sets, when you look back at the data from 2020 forward, there's a big jump in the number of individuals that are experiencing homelessness who are Hispanic or Latinx in 2022, and then that number stays around the same for this year. So overall, the PIT is kind of just a snapshot of homelessness, and despite its flaws, the annual point in time count results are the most reliable estimate of people experiencing homelessness in our country from which we can measure our progress. The results are submitted to HUD annually. They publish a really big spreadsheet with the whole country's PIT count data on their website. And that data is used to inform federal resources and strategy. If you have any questions, I'd be happy to take a stab at answering them.
Don't think we have any right now. Thank you. That's
Okay.
great information. Maybe so actually. One question. Does anyone have a forecast for how so this is done in January, right? So it's
Yeah.
So of course, like there's these 2 important projects coming online,
Mhm.
right? That are gonna create a good increase in basis for unsheltered homeless in our community. The Ramada and Days Inn projects, but they're only going to be, I would assume, sort of partially. They're still going to be going through their intake process, I would assume, by January. So maybe we would anticipate some benefit from them in next year, but they'll continuing. I think they'll still be building out their occupancy after January. So it'll probably be over the next 2 cycles that's going to hopefully push some numbers in a really favorable direction, right?
Yeah. So Compass Point, I believe, will be mostly, if not completely, occupied by January.
Okay.
And so that's 85, I think, units. Most of the folks moving into those units are coming from literal homelessness. A couple of folks are coming from other programs from Homeward Bound. So there should be a good impact from that. I don't know that the Ramada project will be ready for occupancy by that point. So yeah, I would think it would take about 2 cycles to really see the impact from that.
All right.
Again. So I just want to give you guys an update today on some developments pertaining to the Housing Authority of the City of Asheville. First, I want to talk to you about the closure of their waiting lists. So on August 28th, HACA, as we call them, closed their housing choice voucher waiting lists. And they are anticipating that this closure will last through the rest of this year and into the first quarter of 2024. The notice about the closure states that applicants who have already been selected from the waiting list will be processed through to lease up, but they're not going to be selecting any other applicants, and they're not accepting any applications at this point. HUD does permit the closure of waiting lists for public housing agencies when that PHA doesn't have a sufficient amount of units to assist all the applicants in a reasonable time period, which HUD defines as 12 to 24 months, and HACA defines for themselves as 24 months in their administrative plan. So, and at last check, their waiting list was quite a bit longer than 24 months. And of course, closures must comply with fair housing and civil rights requirements. As far as the impact, I think it will be pretty significant for our community. The most obvious, of course, is that no residents or potential residents can make application to housing choice waiting lists. And also service providers will likely experience increased difficulty with housing placement for their clients. Because of the low affordable housing stock in our community currently, these agencies have been pretty heavily reliant on HACA housing programs for placement of the individuals and the families that they work with, particularly because lots of these agencies were also able to submit supportive service preferences until recently, which allowed for faster placement of their unhoused clients into HACA units. So in this way, HACA has been a pretty important partner for addressing homelessness in our community. And even though it's maybe necessary to close the waiting list, it's definitely a blow to the providers, and more importantly, to the folks that they're serving, that they won't be able to submit applications for the foreseeable future. And unfortunately, the waiting list closure also means that the community won't be able to use the waiting list as an indicator of housing demand, and that we may have some difficulty accurately gauging the need among specific populations. Any questions about that?
What other mechanisms are in place to determine the indicator of housing demand? How are we going to know that information?
I think we're going to have to rely a lot on service providers serving specific populations and their lists and tracking mechanisms for applications for other types of housing. I know that some service providers are looking into trying to get on waiting lists for housing authorities in surrounding counties because they don't know when the waiting list will open here, but that's how I think we would have to go about it.
So I definitely don't hear that you love the fact that this is, this
I
idea.
don't love it.
So if you were standing in their shoes for a minute, what would they say about, what would you say about like, well, here's why nobody likes this. Here's why this is necessary right now.
I mean, I think it's necessary because the waiting list is extensive, and because they just don't have enough units to meet the need. It's quite a bit longer than 24 months. And so I think they're trying to like stem the tide a little bit, but it's just really unfortunate, particularly for the folks who would have received supportive service preferences or homeless preferences, which I'm going to talk about more in just a moment too, because that really is, in the absence of affordable housing in general, here, you know, the programs that those service providers are operating under have specific requirements for how much they can pay for rent. And if they can't find units that are within those amounts, then they're reliant on programs like the housing authorities programs in order to be able to place folks.
Okay, so their point of view is like, what's the point of adding more people to a list that's going to take more than 2 years anyway? They're on a list that they're not.
Sure.
The vast majority are not moving through that process, so it's not really slowing anything down because it was already going to be that long. And but part of your point is that there are certain people who might have been able to get a more expedited consideration based on
Yes.
their specific factors,
Yes.
and it closes the door to that.
Right. Absolutely.
Okay.
Awesome. And then last but not least today, I just want to give some information on HACA's policies and perhaps make a recommendation. So HACA operates under a 5-year administrative plan that's required by HUD. And that plan communicates policy choices that the public housing agency makes where the federal government is not explicitly directing public housing agency action and decisions. And this plan can be reviewed and updated by the PHA as needed outside of the 5-year benchmark to reflect changes in regulations and operations or to ensure consistency in operations. And there are some examples here of some amendments that could be outlined or changed in the administrative plan. These are all amendments that were up for consideration by the HACA board recently. It's unclear at this point if these amendments have passed. For the purposes of just kind of providing an example, I'll tell you a little bit more about waitlist preferences. So public housing agencies are allowed to establish these preferences for waitlists and to prioritize folks that meet the criteria for the preferences for vouchers. HACA had previously established preferences around individuals who receive supportive services, as well as individuals who were identified by service providers as experiencing homelessness. And so they had MOUs with several different agencies in town where they would receive these preferences from them, and that would allow for prioritization of those folks to receive vouchers. As far as we understand it now, HACA has done away with those preferences. They've removed the homeless preference entirely, and they've decreased the percentage of applicants that they will accept who have supportive service preference from 50% to 10%. So of course, this change with the closure of the waiting list is undoubtedly going to lead to some significant delays in our community's efforts to reduce the number of homeless individuals here in the community. So HACA has to conform to HUD regulations, including public hearings, with an opportunity for residents and community members to provide public comment. Community development staff regularly attend the HACA board meetings, and they're able to make public comment. But we would also like to be prepared to make appropriate public comment when it's needed. And so we're asking the committee today to authorize staff to work with a member of the committee to submit formal written comments from Buncombe County on proposed changes to housing authority plans and policies. And if you have any questions about that, I'll do my best to answer those as well.
And is that for a specific comment period or just more of an ongoing basis?
On an ongoing basis, yeah.
Sure. to that. Yeah. I mean, it's sort of just like, hey, we're over here doing affordable housing, homelessness related work. They're over here to like, we want to have like ability to, engage and
Absolutely.
kind of, communicate with one another, right, about
Right.
what we're all doing, how to align it, how to make it work more effectively.
Yeah.
I'm all for that.
Awesome. Thank you.
Sure. And the one other piece too that I think would, could be kind of, it's not, well, it's maybe housing authority plans and policies that fall into the plans part, but this is just the other part that is working in this area. I've come to appreciate more its significance is this like allocation of the project-based vouchers that the housing authority gets to decide how to allocate, and just how impactful that can be to the developments. In some ways, like, I mean, as impactful as what we do here with allocation of hundreds of thousands or millions of dollars. So I would love for us to have more opportunities to talk with them about sort of what's the strategy, like how do we, I mean, they're interested in the same stuff we are, like how do we get the most good projects to happen? And so I would just like where I think we're doing so much more with the city now that maybe we're doing in years past. I'd love to kind of, have the housing authorities
Yeah.
programming
Absolutely.
around that important piece also to think about how do we sync all that up, right? It definitely
Yeah.
impacts the performance, and when they make their decisions, all that kind of stuff. So just coordination on that would be great.
Absolutely.
Yes.
Yeah.
All right. Any other thoughts on this? All right. Great.
Thank you.
Great. So y'all will start work, when you like it's appropriate, you'll work up some comments and talk about
Yes.
those, and we're all like, yeah, that's great. And you'll be prepared to submit them in writing or make comments at their meetings, stuff like that.
That's right. Yeah.
Okay. And do you think some of those around like concerns around the homelessness, like not prioritizing that more, that might be something that we submit some comments on?
Unfortunately, it seems like the public comment period may have closed for that. We were still trying to get some clarification from the housing authority on that, even as early as this morning. Their website was down for a little bit last week, and we're still trying to work that out with them. But if it is not closed, yes. If it is, then I think just in the future when it may be appropriate for us to do so.
It would be similar to kind of our approach with the NCHFA and the QAP, just establishing that we have a relationship to work with one of the members of the committee to bring, staff level feedback, to engage with the committee member, and then release a more official comment. As Lacey's mentioned, we have the capacity to attend the meetings and make comment there. It also is kind of elevating it, as a member of this committee, but also our board, communicating directly to another board of appointed individuals, kind of conveys a different level of buy-in to the comments that are provided. We will certainly continue and did attend the meeting last week where they discussed a number of items. And again, we're a little unclear about how they took action on a couple of things, which we're trying to understand. But staff was able to provide comments, that we want to ensure that we have the ability to review materials in advance and make comment that's appropriate, from our perspective, both as, staff working in the space of affordable housing, but as partners with the housing authority on a number of projects and other undertakings that they consider, where we're often involved in with the funder. So
So you want to work directly, if I'm reading that requested committee action, right? You want one of us to be your liaison. I'm happy to do that.
Excellent. Thank you.
Unless.
I mean, I think that sounds fine. I would be curious as what you come up with, right? Just to kind of like have awareness, like what are the things, but that sounds.
Yeah.
and it would be very similar to the QAP where, sometimes the deadline doesn't make it such that we can engage in beforehand. So we have some authority to create a response and then, share out what that, final letter or comment might have been at the next meeting where we don't have the chance to kind of get it in between when they might be having comment and when our meetings fall. So it's really just kind of giving us the blanket cover to be able to send a more formal comment.
That sounds great. So Amanda will be our kind of a liaison with y'all, but feel free to just CC us but kind of with the expectation that like Amanda will be our point person on signing
Okay.
off on all that.
Great.
Sound good?
Thanks so much.
Cool. And so this is just in the idea category. Don't think that it's like anything more than that. But, because I know like we all don't have enough meetings to go to, but I just wonder like, I'll just throw this out, not for something to happen anytime in the near future or even ever. But, I just wonder like maybe sometime like it might, because like I know like, in particular, like we talk with our, like the members of the HCD committee on the city council, right? Because they wrestle with these same issues that come to us. So sometimes we're like, what are you thinking? What are you thinking? And I don't know. So maybe, and the stuff the housing authority folks are doing is related, but in some ways it is kind of distinct stuff. But I just wonder maybe sometime, maybe it would be useful for us to have like a joint meeting with some of their folks and maybe the HCD committee and us to just kind of sit down and just kind of talk about, I don't know, share information, like here's what we're working on, here's what y'all are working on.
Yeah.
Because I think this kind of communication sounds great, but maybe just like an informal kind of meeting sometime, maybe that's worth thinking about so we can just learn a little bit from each other about what everyone's doing and how we can best collaborate going forward. Okay, so I just a thought. So
The housing authority, it is under new leadership with the appointment
Yep.
of a new CEO over
Right.
summer. And I know that transition period takes a while. So, internally with staff, we have meetings, so we can certainly mention, that there's an interest in making the connection between those three entities. We're trying to make those connections at the staff level, kind of all the way through the organization. So I think board member to the respective committees, connecting makes a lot of sense. Happy to share that.
Address this.
Yeah.
For us to have that connection, just like you all do with the staff, I think that'd be great.
Matt, do you think it's possible to slap on to the October 17th, just like a slide of an update on the downtown properties too? Just like
So
a where we're at slide?
Yes.
Yeah.
I will, because Sarah will be here. She typically, I know you've experienced her presentations before, it's usually like focused on one and then there's a slide at least. about the status of the
yeah,
other.
yeah.
So I think it's part of her plan
Okay.
to include that. It wouldn't probably be the primary point of it, but I'll make sure that she provides an update on status. And we can certainly also share the status of it. It's a lot of where we are in that project has to do with working with architects and some of those contracting pieces that we've discussed the budget needs for in terms of environmental studies and other things. So we can certainly provide you clarity with kind of where those projects are and updated timeframes. Because as with all things, there are going to be adjustments to that as you move through the various processes necessary to get there.
Mhm.
We will request that that be included.
So Sarah's coming to this meeting.
That is our understanding.
Okay.
We are seeking to confirm that, she's available. Our hopes, it was initially discussed about coming to the actual with her, but we knew that couldn't be in person. There was a conflict, hoping to have in person because we do have sometimes we have connection challenges in this meeting space. But our anticipation is either in person or preference or potentially remote connection for that meeting.
All right. I think we completed all the pages. So if I could, is there anything else we need to go over from the staff perspective of this meeting today? Okay,